So as we continue along considering historical methods or the methods described in historical osteopathic work, what we're looking at here is a description from Elmer D. Barber. There's multiple parts to this one. So he starts off with essentially a general hip movement or a hip adjustment, depending on how you want to talk about it. This is extremely similar to the description that Dr. Still gives in Research and Practice. So we'll show it to you just so that it's within context. And then it's a movement for the adductors. We'll show that movement, but then we'll also show a possible alternate to it, depending on how the patient is on the table. And then it's just soft tissue work, and we'll show an alternate to that too, because the manner in which Barber suggests it may not be as ideal as we would like. So the first method essentially talks about flexing the leg up to the chest, right? So, and doing so quite heavily. It talks about, as you're doing that, leaning on it with the chest, right? So, and then because the picture or the description is essentially for the right leg, it says move it from right to left. And as you move it from right to left, then what you're going to do is you're going to push it across and straighten the leg out. Now he also suggests, so if you see where my hand is on the inside of the heel, he wants you to turn the thigh in and the foot out. Now you can somewhat do that here, but then the traction is hard because of where your hand is. So instead, what I would suggest, your hand will be pretty nimble whether you want it to be or not, or whether you're thinking about it. If you just cup under the heel here, so you come up quite high, lean on from right to left, push it across, turn the knee in and the foot out, right? So, and then give some traction. He says do that 2 to 3 times, right? So that's the hip. Then he talks about the adductor. So bend both knees and bring your feet together, right? So he says start here, bring the knees up, keep the feet together, and then spread. Right, so this is what he talks about. Now for some people, this will be quite uncomfortable. Also, depending on the surface of your table, this can be quite slippery, right? So this is all he says to do. Just take it out nice and far. Now you also have to consider the patient's clothing. Some clothing, or some people's pants, depending on how they fit them, will make that tough. So you'll actually get bind on the pants before you get bind on the legs. So if we're considering the concepts here, and we consider the concepts that I use to describe methods, we consider relational motion. So one thing stays still, one thing moves in relation to it. So instead of the knees moving in relation to one another and the feet staying still and the pelvis staying still, we can just say, well, let's keep the pelvis still and move the thigh or the adductor or the knee in relation to it. So the knee can be our proxy. As the knee comes away from midline, you can be stretching the adductor. So it could literally be something as simple as this, right? So you can put the foot on the other thigh, right? And then you can support here, and you can stabilize the pelvis, right? So instead of moving both knees, you can move one knee. So that's an alternate. Now the final thing that Barber talks about is moving the muscles of the thigh on either side. So the picture that you'll see in the description says cut G, but really I think that was just a typographic error or a typesetting error. It's cut 6. So if you're in the book, it's cut 6. And he says just move on either side of the thigh. Now because of the nature of the compartments, so the anterior, medial, and posterior compartments, my hand on either side so my hand on the medial side is somewhat on the anterior, medial, and posterior compartments. So I don't know that I'm going to get as much as I want, but essentially he's just talking about moving the soft tissue there as you find bind. What I would suggest, because of the way the compartments work, you can put a hand underneath the thigh and a hand on top of the thigh, and just roll the tissue in relation to the relatively still thigh. So relational motion again, or relatively still femur. All right, so we're going to keep the femur relatively still. Right, so you can reach under here, keep the femur relatively still, and move the posterior compartment, the medial compartment, and the anterior compartment in relation to the relatively still femur. So that's the 3 methods as Barber spoke about them, as well as with some detail and some adjustments. The primary concept here being relational motion. Right, so one thing stays still, one thing moves in relation to it.